You're listening to Health Professional Radio with Wayne Bucklar. My guest today joins us from Melbourne, Australia, where she is visiting from Boston in the United States. It's Dr. Katherine Gergen Barnett, and she is the Director of the Integrative Medicine Clinical Services at Boston Medical Center. Katherine's first trip to Australia. Welcome to Australia, Katherine.
Thank you so much, Wayne. I'm so thrilled to be here, and thank you for having me today.
Now, I understand you're here as the keynote speaker for this year's Blackmores Institute Symposium, which is this week, I think.
That is correct. Yeah, the Blackmores Institute Symposium is this weekend, and I've been very honored to ask to present to them some of my research my colleagues and I are doing at Boston Medical Center on the treatment of chronic pain.
Now, Katherine, integrative medicine is not something I'm familiar with, but then that's not unusual because I'm not much of a clinician at all, I'm afraid. Is that what you're going to be talking about?
So let me just back up by saying you're not alone in knowing so much about integrative medicine. It's a new, in some ways, a new field, but certainly a growing field, although it really draws upon many ancient traditions, some of which are, in the instance of traditional Chinese medicine, over 2,000 years old. So it's really a study of medicine and a practice of medicine that brings in evidence-based modalities, both in the Western medicine tradition, such as pharmaceuticals, surgery, etc., as well as some of the other traditions, such as Ayurveda and traditional Chinese medicine and some Indian medicine, really to bring health and wellness to our patients in safe and effective means. And what I will be speaking about the conference during the keynote is really some of where we've gotten in our current state of medicine today, which is very much, as we all know, for anybody who has either been a patient or a practitioner, one that is largely burdened by chronic illness. WHO has put out many reports recently showing that the rates of communicable disease, ones that we've known for a long time, are happily declining worldwide, but our rates of chronic illness are going up at a rapid clip. And the way that we have practiced medicine in traditional Western medicine is excellent in so many ways and has really been a godsend in terms of treatment for communicable diseases. But in terms of treatment of chronic illness, we know that we actually lack some of the tools to help people in a true kind of underlying way, and not just treating the symptoms, but looking at some of the causes that may be going on for some of the chronic illnesses and addressing those things. And again, it's no fault of any practitioner. That's the way our system is set up. But in integrative medicine, we're really looking at mind, body, spirit, and how we can use all three of these things to get the person to a place of greater wellness.
Now, Katherine, as soon as you mention spirit in many clinical circles as a degree of cynicism, your work is research-based, I understand.
Yes. Thank you for clarifying. Yes, it's everything we do is based on evidence-based medicine. We're very heavy research-based group. We have grants from the NIH and from federal funding, and what we're doing in terms of the quote-unquote spiritual is really looking at something called mindfulness, which has had a tremendous amount of literature and research behind it in terms of looking at some of its efficacy for things like chronic pain and depression, cardiovascular disease. But really, what we're doing is, again, integrating those modalities into a larger medical setting. And so, for instance, with our care for people with chronic pain, which is one of the main focuses of my talks at Blackmores Institute this weekend, we're looking at how we can treat people with chronic pain using some of the integrative medicine approaches, but also really deeply looking at other things such as, are there nutritional deficiencies that are happening with our patients? Are there ways that we can kind of bolster their health through things such as an anti-inflammatory diet? Can we bring in, their primary care physicians to treat them with different kinds of medications, and are we able to decrease some of their kind of sequelae of chronic pain, such as depression, by being in a group visit setting, such as that they get support from other patients who are suffering from chronic pain, and they know that they're not alone, and that actually goes a long way in decreasing their pain and suffering.
Now, Katherine, just for some of our audience who are not familiar with the American system, NIH, that's the funding body you mentioned. What is that body?
So that's the National Institutes of Health. It's a very well-regarded collection of researchers based down in Maryland, the Washington, D.C. area, that has the largest amount of federal dollar funding. And they give a number of grants through, they have many different kind of branches of study, and they give a number of grants, and it's very prestigious to get grants from them. And they've done tremendous work in advancing the research field on all levels of medicine.
Thank you for clarifying that for me.
Yes, thank you.
Given that you're here talking about your research in pain management through this integrative approach, I assume you've got some results that are fairly positive.
Yes, thank you for asking. So we've actually, our group's our approach to chronic pain is called Integrative Medicine Group Visits. And the setup is such that patients meet for 9 weeks in a group of up to 12 patients for 2.5 hours per session. And in that time, as I shared, we do many different modalities. And the first set of data that we got after several years of running the group is that we had enormous reductions in pain, symptomatology. We had reductions in depression. We had improvements in sleep. We had a reduction in perceived stress. And so our results were able to carry us forward into earning a very prestigious grant, again, federally funded, something called PCORI, which is a patient-centered grant that the Obama and this sort of Affordable Care Act have been very focused on patient-centered outcomes. And they granted us a $1.8 million grant to look at our standard of care versus our intervention, and to see what the comparison was for our intervention versus standard of care for our patients. And so we're currently 2 years into that study, and that we haven't published the outcomes. It is continuing to be very exciting and very reassuring in terms of the reduction in a lot of the most bothersome symptoms for people.
You're listening to Health Professional Radio. My name is Wayne Bucklar, and my guest today is Dr. Katherine Gergen Barnett. Katherine's the director of the Integrative Medicine Clinical Services at Boston Medical Center, and she's here in Australia to speak at the Blackmores Institute Symposium this week as their keynote speaker. Katherine, many of our audience are clinicians, about 95% of them in fact are doctors, nurses, allied health professionals, either in acute care or a lot in aged care. What message would you like them to take away from having heard you today?
Well, I just want us all to be able to think a little bit outside of the box in terms of taking care of our large numbers of people living with chronic pain. In Australia, it's 1 in 5 people below the age of 65, and once you get greater than 65, it's 1 in 3, and these rates are very parallel in the U.S. And really the message is thinking about the whole person, seeing what you can do to sort of not only treat their symptom of pain, but perhaps get a little bit deeper into some of the causes of their pain. And it's not all about fixing, but rather sometimes it's about healing some of those causes.
Well, getting clinicians to think outside the box is never a quick process in the health industry, but I'm sure there'll be some who will be very interested to hear what you've had to say and what you'll be saying on the weekend. Is there a common misconception about your work that, drives you nuts and keeps you awake at night?
I wouldn't say very much keeps me awake at night, since I have 3 young children and I work full time. But I will tell you that I think this is changing happily because of the quality of research that is being done in this field, including ours at Boston Medical Center and many others in the U.S. and the Blackmores Institute here. But I think that for me, it's really making sure that we are putting together good studies and that we're publishing our studies so that all of us as scientific clinicians can really work together, look at the evidence, wipe away some of our biases and really look at what's best for the patient.
Well, let's hope today that we can address that misconception with perhaps just a few, but we'll do our best. Katherine, it's been a pleasure having you on with us today. Thank you for making the time available.
Thank you so much, Wayne. It's an honor to do this work and to speak with you today about it.
If you've just joined us, you've just missed my conversation with Dr. Katherine Gergen Barnett, who's here for the Blackmores Institute Symposium this weekend from her regular job as the Director of the Integrative Medicine Clinical Services at Boston Medical Center, obviously in the US. The good news, however, is that on our website, we have a transcript of my conversation with Katherine. We also have an audio archive on both SoundCloud and YouTube. So if you head off to our website at www.hpr.fm, you can check out either the audio or the transcript. My name's Wayne Bucklar. You're listening to Health Professional Radio.